Fibroids are muscular tumors that grow in the uterus. They are almost always benign, meaning they are not cancerous. These growths can vary significantly in size, ranging from tiny, almost microscopic seeds to large, bulky masses that can distort and enlarge the uterus. Some fibroids can grow as large as a grapefruit or even bigger. They can grow as a single tumor or in clusters, and their growth patterns can vary widely from one woman to another. Many women develop fibroids at some point in their lives, often without even knowing it. These growths are most common during the childbearing years, typically between the ages of 30 and 40, but they can occur at any age. While some women with fibroids have no symptoms and may never know they have them, others can experience a range of symptoms that can affect their quality of life. Symptoms of fibroids can include heavy menstrual bleeding, prolonged periods, pelvic pain, and pressure. Some women may also experience frequent urination, difficulty emptying the bladder, constipation, and back or leg pain. In some cases, fibroids can lead to reproductive issues, such as infertility, multiple miscarriages, or early labor during pregnancy. The exact cause of fibroids is not known, but several factors may influence their development. Hormones, particularly estrogen and progesterone, which stimulate the development of the uterine lining during each menstrual cycle, appear to promote the growth of fibroids. Genetic changes and growth factors that help the body maintain tissues may also play a role. Understanding fibroids is the first step to managing them effectively. If you suspect you might have fibroids, talk to your doctor. They can help you determine the best course of action based on your symptoms, the size and location of the fibroids, and your overall health and reproductive goals. Treatment options for fibroids vary widely. For women with mild symptoms, watchful waiting may be recommended, where the doctor monitors the fibroids over time to see if they grow or cause symptoms. Medications can help regulate the menstrual cycle, treat symptoms like heavy menstrual bleeding and pelvic pressure, and sometimes shrink fibroids. In more severe cases, surgical options may be considered. Myomectomy is a procedure to remove fibroids while preserving the uterus, which may be important for women who wish to have children. Hysterectomy, the removal of the uterus, is a more definitive solution, but is typically considered only when other treatments have failed or are not suitable. Other less invasive procedures include uterine artery embolization, which cuts off the blood supply to the fibroids, causing them to shrink, and MRI-guided focused ultrasound surgery, which uses high-frequency sound waves to destroy fibroid tissue. It's important to discuss all available options with your healthcare provider to determine the best treatment plan for your specific situation. Each woman's experience with fibroids is unique, and what works for one person may not be the best choice for another. If you suspect you might have fibroids, talk to your doctor. They can help you determine the best course of action. The exact causes of fibroids are still unknown. Despite extensive research, the medical community has yet to pinpoint a single definitive cause. This makes understanding and treating fibroids particularly challenging. However, there are several factors that seem to play a role. These factors are often interrelated, making it difficult to isolate one specific cause. Hormones like estrogen and progesterone, which are involved in the menstrual cycle, seem to promote fibroid growth. These hormones stimulate the development of the uterine lining during each menstrual cycle, and fibroids contain more hormone receptors than normal uterine muscle cells. Family history is another factor, as women with a family history of fibroids are more likely to develop them. This suggests a genetic component where certain genes may predispose women to developing fibroids. Other factors that may contribute to fibroid development include early menstruation, obesity, and vitamin D deficiency. Early menstruation means longer exposure to estrogen, while obesity can increase estrogen levels in the body. Vitamin D deficiency has also been linked to an increased risk of fibroids. More research is needed to fully understand the complex interplay of these factors. Scientists are continually studying fibroids to uncover more about their causes and to develop better treatments. Understanding the underlying mechanisms can lead to more effective prevention and management strategies. Fibroids are classified based on their location in the uterus. Intramural fibroids grow within the muscular wall of the uterus. Subserosal fibroids grow outward from the uterus into the pelvic cavity. Submucosal fibroids grow into the uterine cavity. The location and size of a fibroid can influence the symptoms experienced. For example, submucosal fibroids are more likely to cause heavy menstrual bleeding than other types. Fibroids can grow slowly or quickly. Some may remain small for years, while others can grow rapidly. Growth is often influenced by hormone levels. The duration of fibroids varies greatly. Some shrink and disappear on their own, especially after menopause when estrogen levels decline. Others may persist for many years. It's crucial to monitor fibroid growth through regular checkups with your doctor. This will help determine the best management strategy for you. Section 5. Effects of fibroids on the body. Fibroids can cause a range of symptoms, including heavy menstrual bleeding, pelvic pain, frequent urination, constipation, and pain during intercourse. Large fibroids can also put pressure on the bladder or rectum, leading to discomfort. In some cases, fibroids can interfere with fertility by blocking the fallopian tubes or affecting the uterine lining. If you experience any of these symptoms, it's important to consult your doctor. They can help diagnose the cause and recommend appropriate treatment. Section 6. Treatment options for fibroids. Treatment for fibroids depends on several factors, including the size and location of the fibroids, the severity of symptoms, and the woman's desire for future fertility. Fibroids are non-cancerous growths that develop in or around the uterus. They can vary greatly in size, from being as small as a pea to as large as a melon. The treatment approach can be tailored to each individual, ensuring that the most appropriate and effective method is chosen. Medications can help manage symptoms like pain and heavy bleeding. These medications may include hormonal treatments, such as birth control pills, which can help regulate the menstrual cycle and reduce bleeding. Non-steroidal anti-inflammatory drugs, NSAIDs, can also be prescribed to alleviate pain. In some cases, gonadotropin-releasing hormone, GnRH agonists, may be used to shrink fibroids temporarily. Minimally invasive procedures, like uterine artery embolization, shrink fibroids by cutting off their blood supply. This procedure involves injecting small particles into the arteries that supply blood to the fibroids, causing them to shrink and die. Another minimally invasive option is laparoscopic or robotic myomectomy, where fibroids are removed through small incisions in the abdomen. In some cases, surgery to remove the fibroids, myomectomy, or the entire uterus, hysterectomy, may be recommended. Myomectomy is often preferred for women who wish to preserve their fertility, as it involves removing only the fibroids while leaving the uterus intact. Hysterectomy, on the other hand, is a more definitive solution, as it involves the removal of the entire uterus, thus eliminating the possibility of fibroid recurrence. Your doctor will discuss the best options based on your individual circumstances. It's important to have an open and honest conversation with your healthcare provider about your symptoms, treatment goals, and any concerns you may have. Together, you can develop a personalized treatment plan that addresses your specific needs and helps you achieve the best possible outcome. Section 7. Preventing fibroids, practical tips. While there is no guaranteed way to prevent fibroids, certain lifestyle changes may help reduce your risk. Maintaining a healthy weight through diet and exercise is important, as obesity is a risk factor. Managing stress levels can also be beneficial, as stress can disrupt hormone balance. Limiting alcohol consumption and avoiding smoking are also recommended for overall health and may play a role in fibroid prevention. Section 8. Dietary recommendations for fibroid management. Certain dietary changes may help manage fibroids and reduce symptoms. Eating a balanced diet rich in fruits, vegetables, and whole grains is essential. These foods provide fiber, which can help regulate estrogen levels. Foods rich in omega-3 fatty acids like salmon and flax seeds may also be beneficial due to their anti-inflammatory properties. It's important to discuss any dietary changes with your doctor or a registered dietitian. Section 9. Living well with fibroids. Being diagnosed with fibroids can be overwhelming, but it's important to remember that you are not alone. Millions of women are living with fibroids, and effective treatments are available. By staying informed, seeking medical advice, and making healthy lifestyle choices, you can manage your symptoms and live a full and active life. Remember, knowledge is power. Don't hesitate to ask your doctor any questions you may have and advocate for your health.